Welcome to this brief presentation on repetitive transcranial magnetic stimulation. Now, the story actually started a long time ago in the Roman era, where a physician called Scriboni Largi noticed that people with muscle ache, if they put their feet over electrical organs of a fish, sometimes had a muscle ache get better. Thankfully, in more modern eras, people like D'Avançon in France created a TMS coil that can let you see white lights or phosphenes, and later Sylvanus Thompson created a TMS coil that let you smell and taste things upon stimulation. But the modern era of RTMS started in 1985 in Sheffield when Dr. Barker, A.T. Barker, created what is more or less the modern version of TMS. Now, how does TMS actually work? Now, we have Michael Faraday to thank for that, and essentially it uses principles of electromagnetic induction, where the magnetic field passing through the brain would generate electrical pulses or action potentials within the brain, in this case a very focused potential. Now, what's the evidence? Well, there's many meta-analyses that show that it works for many conditions, but you need some brain porn. And essentially that's a picture of TMS having distal effects on dopamine release and cortical blood function. Essentially it's like driving a gear, where you stimulate one part of the brain and the rest of the brain gets stimulated. And what do you use it for? Essentially depression and auditory hallucinations. It works for those things. Now, what are the side effects? Well, noise-induced deafness, there's a big clicking noise each time it goes off. It can induce fits theoretically, and very rarely there's a chance of inducing mania. And that's all, folks. Check Google Plus for your quiz.
Created using Powtoon.